Hi, everyone. Let's talk about psychoanalysis, therapies, psychiatric intervention, and why understanding all of these is so important. Rule number one, why you need therapy. Please understand anyone who is experiencing emotional pain, grief, and they are unable to manage that. It is somatically converting into window shopping, aggressive shopping, food disorders, sleepless nights, headaches, anxiety, not able to process your thoughts, cognitive decline, cognitive fog. You have to understand that you require therapy because it is becoming overwhelming for your system, your body to manage it. Rule number two, first, you start with therapies, not medications immediately. Anyone who is telling you to start with medications, please be a little more careful in understanding that ask them questions. Is there a better way to function? Can I work without medications? Can I seek better support without medications? Most of the psychiatrists, at least I work with, they are very therapy pro and they are very ethical. So at least I'm very confident that those psychiatrists will not give medicines unnecessarily. Number two, when a psychiatrist starts giving you medication, you have to understand that how long the treatment is going to go. The basic science behind therapy and psychiatric intervention and diagnosis is that once you start therapy, then if you do not show improvement in a certain period of time, then you require clinical diagnosis. Once you get the clinical diagnosis, then it has to then move into a psychiatric intervention. Now, once this loop is over, your psychiatric intervention should not end that, okay, now I'm taking medicine, so I should stop therapy. No, that is the worst thing people do to themselves, because medications will help you understand, open up your receptors to work on your mental health. It is like a muscle memory. You had some old patterns. You were not able to change only with therapy. You could only move 2 steps and you were expecting to move 5 steps. The diagnosis and the psychiatric medicines are going to open your receptors, and then you are going to see that whatever you are learning in therapy, you are able to implement it faster. You are able to bring the changes faster. Now, when you bring in the changes, you are breaking the old patterns and recreating the new, healthier patterns. And then that's when the medication goes down. So you have to understand that all these three things, therapies, psychologist, clinical psychologist, and psychiatrist, they work hand in hand. They cannot work in isolation, because if therapies are not working, you need clinical diagnosis, and your psychologist should be able to guide you to a clinical practitioner to get the evaluations done. And once the reports are out, then you need to meet the psychiatrist for the medication and continue therapy. Now, you have to also understand that why, if somebody is only taking medicines and not therapy, what is going to happen? You have to understand that medications are going to work at certain level. Either it fixes the problem, or you would require further stronger dosage to work on yourself. And if that is the case, then it means that you require therapy even more strongly, because what is happening is that you are just increasing